Thanks so much for joining us today. As we said earlier, feel free to turn your cameras on if you'd like. We'd love to see you, but totally understand if you're more comfortable keeping them off. Before we kick off into today's webinar, just to let you know that we have more events coming up that are free for the rest of July. So on the 22nd of July, we have an indoor plants webinar with the Irish gardener. So he will be able to answer any plant questions that you might have. And also on the 28th of July, we have a free nutrition webinar where it's all about any information that you need on nutrition. And also anyone who signs up and attends that webinar will be giving away a free consultation to the value of €130. So that's a really good one if you guys would like to join. But for today, I'm really excited to have Dr. Pau Castell here. As you may know, we have an amazing new medical centre at Central Park, which I know so many people were dying to have for so long. So we're absolutely delighted that that is now an option and available to everybody who works and lives at Central Park. So it'll be very convenient when you guys are back in the offices. And she is here today to talk to us about women's health, which is a hugely important issue, and I'm really looking forward to it. So I will pass you over to Dr. Pau, and she'll take over today.
Okay, thank you very much, Lisa, and thank you, Hazel, for the warm welcoming. So we are really happy to, to have people like you here, and it's, we have been feeling very well accepted in the community. So it's very nice to see the neighbors and to see, live work and grow, supporting us, helping us and welcoming us. So here we are, 2 doctors and 2 receptionists for the moment. We are going to get soon a dentist and probably a physiotherapist, a counselor. So I work here together with Dr. Ignacio Aro, and we have 2 brilliant receptionists, Avelina and Ashling, that if you have any questions, they are always very, very nice, and they can sort out any of your queries. Okay, I'm gonna start introducing my background. So I'm a doctor. I studied medicine in Spain, and after medicine, I did my training in family medicine. That I finished in 2000, so it was a full training in general practice that I finished in 2002. I completed a training in occupational health after in the University of Barcelona, and now I'm also clinical tutor in UCD, in University College Dublin, since 2014. I have a special interest as a GP in women's health, but also in point-of-care ultrasound. Point-of-care ultrasound is ultrasound outside the radiology setting. It's for certain medical conditions. So ultrasound that we can do in general practice in my case. And I also hold a certificate in contraception from the ICGP since 2014, certificate in obstetric ultrasound that I did in UCD and in the National Maternity Hospital, and I did it between 2017 and 2018. I'm now just in the middle of my certificates in menopause. As a work experience, I started working straight away after my first training in 2002, first in the Canary Islands, then in Barcelona for a few years. And I moved to Ireland for the first time in 2006, where I was working in Dublin 1 in Custom Houses Square Medical Centre as a GP. And then in 2008 and 2009, for family reasons, I moved back to Spain. I was working in Catalonia as a general practitioner. And while my experience there, that was 6 years, I was lead in this medical center in tobacco and alcohol. I also was leading joint injections. I also qualified as a trainer for general practitioners in the national scheme for family medicine, and also participated in a pilot program for point-of-care ultrasound, therefore my interest in ultrasound. And since 2014, so in 2014, I moved back to Ireland, where I joined again Custom House Square Medical Centre in Dublin 1. And after a short period of time, I was appointed medical director. And it's only 3 months ago that I started my own practice here in Central Park. Together with Dr. Ignacio Haro. I'm GP, but we are also founders and directors of Central Park Medical. And yeah, that's my background. First of all, we are going to talk about screening programs, and we will talk about the screening programs linked to women's health. So what is a screening program? A screening program test is designed for populations of individuals who do not have any symptoms of the disease. So it's eligible population that are at higher risk of certain diseases that are invited to take part on screening programs. The aim is to identify those people at risk, to provide them with a screening test for an early diagnosis, to make sure, to ensure further diagnosis and for an early treatment. We will start talking about the breast check. So you probably are familiar with the breast check, the screening program for breast check. That is, so the eligible population here would be women between age 50 and 69. Why? Because the risk of breast cancer increases at an older age. There is no need of registering for the breast screening program. Eligible women will be contacted within 2 years after their 50th birthday. But you can check online if you are registered or not, or if you are not registered and is your age group, then you can contact them. Why is important to do the breast screening? It's just because it helps to find cancer breast cancer at a very early stage. If it is found early, it's easier to treat it, and therefore better chance for recovery. So breast screening involves a mammogram. A mammogram is like an X-ray for the breast that can detect breast cancer. When it's very small, we cannot see it or we cannot feel it. So after 3 weeks approximately, you will get a letter with the results, and the GP will get the report as well. Most of the results are normal, but it has been proven that the number of deaths due to breast cancer has decreased a lot with the breast screening. And I'm going to show you now a video. So one of the most important things is to prevent breast cancer. And to prevent breast cancer, a part of the screening test, what we recommend, and other things that we will talk after, one of the most important things is to do a self-breast check. I won't talk too much about it because we have a fantastic video here that lasts 2 minutes, and that explains very well how to check your breast and when to check your breast.
Early detection of breast cancer is key to survival. Checking your breasts every month is vital. It just takes a few minutes, but it can save your life. The best time to do it is about a week after the end of your period. If menopausal, check on the same day every month. Standing in front of a mirror, raise both arms above your head. Look for physical changes like puckering, dimpling, or redness of the skin on the breast. Check for veins that stand out more than usual for you. Remember, your breasts may be different sizes, but check if one has got larger or lower. Put your hands on your hips, hunch and lean forwards. Look at the nipple to check for changes such as nipple inversion, crusting, redness, swelling, bleeding, discharge, or a change in direction or shape. Now, using 4 fingers and the flat of your hand, begin at the outer edge and move your hand slowly around the whole breast in a circle, checking for any lumps, thickening or bumpy areas that seem different from your other breast tissue. Work in increasingly smaller circles until you reach the nipple. Make sure you cover the whole breast. Once you've checked your breast, check your armpit as breast tissue extends here. Gently squeeze the nipple and look for discharge. Once you have done all this, check your other breast. You might find it easier to feel for changes in your breasts while in the shower or lying down. Just don't forget to also look for changes in front of the mirror, and remember to do it every month. If you do find something, don't panic. The majority of breast changes are non-cancerous. But to be sure, see your GP without delay.
Sorry. Okay, so I hope you enjoyed the video. So important, how do we prevent breast cancer? We prevent breast cancer, first of all, by having the breast checks when we are eligible. Second, by getting into the habit of looking at and feeling our breast, to get used to any abnormalities. And if there is anything, so to get used to your normal breast, and if there is anything abnormal, to go to your GP. And then there is other things that we can do to prevent breast cancer. And that's the basics. It's for everything, but it's important because it really decreases the risk of breast cancer. Having a healthy weight, limiting alcohol intake, breastfeeding decreases the risk of breast cancer as well. Checking the breast, getting active, and avoiding smoking. We'll go now to the cervical check, and we will talk about cervical check, the national screening program to prevent cervical cancer. This program provides with free cervical screening tests to women and people to women and people with a cervix between age 25 and 65. Now the test is called HPV cervical screening test. And it's a very simple procedure, and it takes only a few minutes. If you are not called, you can register in their website. So this cervical check is one of the best ways to protect yourself from cervical cancer. But there is another thing that we can do to prevent cervical check, and is HPV vaccine. Okay, so the procedure is very simple. What we do is it's very simple. We take a small sample from this part of the cervix. I don't know if you can see it. From this part of the cervix, a bit, I'm circling it. Can you see it? A bit, we take a small sample. This sample is analyzed for HPV. If HPV is positive, then in that case, the same sample is checked for abnormal cells. And if the sample shows abnormal cells, then the patient is sent to a special clinic, to a colposcopy clinic, for further investigations and for treatment. We'll talk about HPV vaccine because it's very important, and it also decreases hugely, dramatically, the number of cervical cancers. So the HPV, human papilloma virus, is a common virus that affects both men and women, and 80% of the population will get it once in life. By vaccinating people, the number of cases decreases dramatically. It's in the immunization program in school. Children age 11, 12 years in first year secondary school will be offered their vaccine. Infections will, cervical cancer and the genital warts decreases in 71% for people that have been vaccinating. So preventing cancer is always better than treating cancer. And that's the reason we encourage people to vaccinate their children. We'll pass now to talk about contraception. There is different kinds of contraception. We have long-acting contraception and short-acting contraception. Long-acting contraception is contraception that we don't have to think about taking every day or every week or every 3 weeks, that we insert or that it lasts longer. And short-acting contraception are the typical pill. Hormonal contraception and non-hormonal contraception. Hormonal contains hormones, and non-hormonal, for example, condom or certain intrauterine devices like the copper coil would be non-hormonal. And reversible and non-reversible contraception. Reversible is that once you take off the contraception or stop taking it, you can get pregnant again. Non-reversible is that there is no way of, it's very difficult to get pregnant again. Because it's it's just a definitive method of contraception. Okay, let's see the methods of contraception. Here we have some images of contraception methods that are reversible. The condom. The second one, this one is the NuvaRing. This one is hormonal. It's short term, but it's a special short term because you can have it for 3 weeks in your body and you don't have to remember every day to take it. So it's short acting, but special short acting. Then we have here the pills that they are hormonal. In the pills, we have 2 different kinds of pills. The combined pill and only progesterone. Only progesterone is known as the mini pill, which is compatible for certain medical conditions and breastfeeding. Let's go to the coil. Here, it's a long-acting contraception. It can last between 3 and 12 years. And here we have 2 different kinds of coils. One is hormonal, the white one is hormonal, and the copper coil here is a non-hormonal contraception, both long-acting. Then the diaphragm is for people that cannot really take anything. It's a non-hormonal one. It's a device, a latex device that you fill with a spermicide, and you have to learn, and you introduce in your vagina just to cover the cervix and to avoid contact of the sperm with the egg. For the diaphragm, you have to go to a special doctor just to have it fitted because there are different sizes and you have to learn how to use it properly. The implanon. Implanon is this part that you have here, that you can see here. It's introduced subcutaneous in the arm. You can feel it, but you cannot see it. This one is hormonal and is also long-acting and lasts for 3 years. It's ideal for younger people. And Depo-Provera is also hormonal. It's injection, progesterone. It lasts 3 months, and it's not recommended to use it for over 2 years. You get the injection every 3 months, and for certain condition is also recommended. And here we have the Evra patch. The Evra patch is another special combined contraception that is short acting, but is not the short acting that you will take every week. So that you will apply it once a week for 3 weeks, and then you will do 1 quick break, and during the break you will get your period. So it's something similar to the oral contraception pill, but in different form and easier to administer. Then we will talk about non-reversible contraception methods. So non-reversible contraception methods, we have in the male, the vasectomy, that is more than 99% effective. A vasectomy is the male sterilization. It's a surgical procedure to cut or seal the tubes that carry a man's sperm to avoid the pregnancy. So it's a cut here. It's surgical, but it's done with under local anesthetics, and the procedure takes about 15 minutes. And then we have the female non-reversible sterilization with this, which is tubal ligation. This one requires general anesthetics. It's a surgical operation, and what they do is to cut the fallopian tubes just to avoid the eggs access to the womb. Okay, let's talk now about irregular periods. Okay, irregular periods. Every woman will experience irregular periods from time to time. Though in the most cases it's not dangerous, it is important to figure out what are the causes of irregular periods. So what is a normal period? A normal period is a period every 28 days, but it's also a normal period. The normal could be also anywhere between 21 and 35 days. Okay, so regular periods less than 21 days cycle, and they are too short, and periods over 35 days cycles, they are too long. So in those cases, we recommend to have it investigated to see what is the cause of it. On average, a period would last between 3 and 5 days. And subtle variations are normal. So if you have a change once every now and then, so not in a regular basis, so only once, it's better to wait to see if it becomes a pattern or if it goes back to normal. So when can a period be called irregular? When the period is late, it could be called irregular, or when the period is too early, when the period is like, you know, very small amount of bleeding, or when the period is heavy. And as I said before, a short cycle is the bleeding is less than 21 days after the previous period, and a delayed period is when the period is more than 35 days from the previous period. Okay, what are the causes of the most frequent common causes of irregular periods? Stress, diet, diet in excess, and lack of diet, lack of nutrients, so both. So excessive consumption of alcohol and junk food could cause irregular periods, but also a diet in lack of nutrients. Contraception, so certain contraceptives, all the contraceptives that are not combined, that contain only progesterone, they cause irregular periods, but that's something normal, and that's something that the doctor will be always advising. So you will go with this contraception, but you won't get regular periods, and that's the normal. Okay, PCOS, in case of PCOS, that needs to be investigated as well, and that's something very common as well. So lifestyle habits like irregular eating or sleeping habits can change your cycles, and medically anemia and thyroid issues can make changes as well. Okay, and what do I do if I have abnormal periods? So we know the causes, so we try to treat the causes. So control of stress, follow a healthy diet and healthy lifestyle, and visit your GP for investigation. Not if it once, but if it's something on a regular basis, it's worth it to go to your GP and to get investigations for thyroid issues, for anemia, for polycystic ovaries, just to talk to your doctor or to identify what is the cause and to approach stress or to approach other issues that could be causing the irregular periods. Okay, and now it's the last part of the presentation, and we will talk about pregnancy. And what is the role of the GP in pregnancy? So that's something, you know, we have a very international community here. We have people from everywhere. In every country, the management of the pregnancy is different, and people is usually surprised in Ireland. What is the GP doing here? If I'm pregnant, what is the GP doing here? So the GP in Ireland has a role, and it's part of our training. So the first thing is to make sure that the patient is taking folic acid. So if you are planning to conceive, start taking folic acid 3 months before trying to conceive. If you get pregnant and you were not taking folic acid and you want to continue with the pregnancy, then start taking folic acid as soon as you can. Okay. If the pregnancies can be planned or unplanned. If you have an unplanned pregnancy, go and talk to your GP. Okay. Then the Mother and Infant Care Scheme is the scheme that in Ireland follows the scheme to follow pregnancy between the maternity hospital and between the GP. So it's a scheme. The first time you go to your doctor when you are pregnant, the doctor will explain you how it goes. So what we do is we sign the scheme after the first appointment. At the first appointment with your GP, the GP will refer you to the hospital, will give you advice about lifestyle, about diet, about exercise, about taking folic acid, about pelvic floor exercise. Pelvic floor exercise is very important to avoid urinary incontinence after delivery, but it's also important to have an easier delivery. And pelvic floor is important during pregnancy and after pregnancy, but is important for women's health all their lives, so not only in pregnancy. Vaccinations. And there are 3 vaccinations. So there were 2 vaccinations that were highly recommended during pregnancy, the flu vaccine and the whooping cough vaccine. But now there is a 3rd vaccination that is relevant, and it's the COVID vaccine that a pregnant woman will get in the maternity hospital between week 14 and 36. Okay. Perinatal mental health, very important. So the GP will just do a brief counseling, a brief introduction about perinatal mental health. Just having an early approach to any psychological issues during pregnancy can avoid so many postnatal and perinatal depressions. So it's very important that the GP talks to you about it. And if you have any problem, that you talk to your GP to make the approach. There is very good support in the hospital. There is very good perinatal mental health units in the maternity hospital, and we can refer you to them. Another thing that it's important is, of course, having a healthy lifestyle, not drinking alcohol, smoking, coffee. Coffee is okay during pregnancy, but once a day. So the abuse of caffeine is not good during pregnancy, and of course, drugs misuse. Okay, and a question: when do I get my first scan? In the hospital, the first appointment in the hospital with the national, with the Mother and Infant Care Scheme is at week 12. Not in every hospital you will get an ultrasound, but now I can tell you that the most of the hospital do a scan at week 12 to confirm pregnancy, to confirm the dates, to confirm that everything is fine, unless there is any abnormality or any bleeding or uncertain dates. In that case, your GP will send you for an ultrasound earlier. But if not, the first scan is at week 12, then the biggest scan, the anomaly scan, is at week 20 in the hospital, and then from week 24 is when you start seeing the GP. So from week 24 is one appointment with the GP, one in the hospital, one in the GP, one in the hospital. And what is the role of the GP is just to make sure that the pregnancy is going well, that there is no risk of preeclampsia, gestational diabetes, that there is no infections, that the uterus is growing correctly, that there is a heartbeat, and that the heartbeat is going, correctly as well. And I will talk now also about some additional services for expectant mothers that we can offer here at Central Park Medical. So at Central Park Medical, we can also offer early pregnancy ultrasound. That's an ultrasound ideally between week 7 and 12 to confirm pregnancy. to look for multiple gestations, to see the fetal heartbeat, to determine the gestational age and the due date, and also to determine if there is an ectopic pregnancy or a risk of an ectopic pregnancy or a miscarriage. There is also other investigations that are very popular in other countries. You might be familiar with Panorama and Harmony. We can provide here at Central Park Medical also non-invasive prenatal test called, and the test we do is called Ninalia, but it's another brand. So Panorama, Harmony, Ninalia, those are different brands. Those are genetic tests to detect the most common chromosomal abnormalities: trisomy 21, Down syndrome; trisomy 18, Edwards syndrome; and trisomy 13, Patau syndrome. Those tests are non-invasive, are expensive because it's a genetic test that gets DNA from the mom's blood, and this DNA, this fetal DNA, is analyzed, and this is the expensive part, the analysis of the blood test. And it's an early, it's very early, at an early stage, so we can do it from week 10 of the gestation. And a part of the blood test, we also do an ultrasound to confirm the date, to date the pregnancy, and to confirm that the pregnancy is going well. Okay, so early pregnancy scan, and this is the test that we did, an Ninalia test. Okay, so, and this is the last slide. So I was quicker than I thought in my talk. It's just recommendations about general health and wellness in women. Okay, so a healthy weight and healthy diet is very important. Limit alcohol intake. Don't smoke. Do your cervical checks and do your breast checks. About mental health is very important during pregnancy, but also out of the pregnancy, in our woman's in a woman's general life. It's very important. Sexual health is very important, and another thing that is very important is to sleep well. And this is the end of my presentation. I would like to share with you some links that I think are relevant. So one is, the link of our medical center. I also attached the link for cervical screening if you have any questions, or if you want to check, if you are due a screening or not, or if you want to register for cervical screening. A link for breast screening test. The video about the self-breast examination. Another link for contraception, and a link for pelvic floor that I find is relevant during pregnancy, not only during pregnancy, also before and after pregnancy, to avoid prolapses, urinary incontinence, and other issues. Our website, our email, and our phone number is here. So we have Aisling and Avelina in reception, and they are lovely, and they are always very nice, very kind, replying to any of your questions. And we are here to help you if you need any help from us. So feel free to pop in, or to send us an email, or to give us a call. It's a pleasure for us to help you. Thank you.